As a Canadian, I find it difficult to imagine life without access to publicly funded healthcare. And I always find it a bit silly when I hear Americans talk about how oppressive socialized medicine is. Yes, I cannot tell you how oppressed I feel by the fact that I will never be bankrupted by medical bills. So a lot of the scaremongering about Obamacare doesn't really make much sense to me. Now, of course, Obamacare is going to be different from what we have here in Canada, because in Canada, all the bills go to the government, whereas with Obamacare, you're just forced to pay for insurance. And an argument that people who don't like the idea of citizens being forced to pay for health insurance like to use is that if the government can force you to pay for health insurance, they can force you to buy broccoli. But they seem to be missing a fairly important distinction between these two things. You see, if you go into an emergency room and you can't pay for the services that the doctors give you, they have to treat you anyway. If you need broccoli but can't pay for it, nobody's going to be forced to give you broccoli for free. The individual mandate doesn't actually force you to purchase anything. It simply forces people to pay for the services that emergency rooms are legally obligated to give them. Now, if there were a law that said if you need broccoli but can't pay for it, the grocery store has to give it to you for free, then legally mandating that everybody buy broccoli shortage insurance would make perfect sense. Because if there were a law that said that the grocery store had to give you broccoli even though you can't afford to pay for it, then by taking advantage of that law, you're not only burdening the grocery store, you're burdening every other broccoli consumer. Because to make up for the cost of giving away all this free broccoli to the people who can't afford to pay for it and didn't bother to buy broccoli shortage insurance, they're going to have to pass the cost of all this free broccoli on to other broccoli consumers, making broccoli more expensive for everybody else. And it's the same with healthcare. If you walk into an emergency room and take advantage of the law that says they are legally mandated to care for you, even if you can't pay out of pocket and don't have insurance, then you're freeloading. And if this sounds like a conservative argument for the individual mandate, it's because it is. This is a policy that conservatives used to endorse. But now that it's a policy that's been adopted by Democrats, all of a sudden they're conveniently opposed to it. So if the government can make you pay for this health insurance, does it therefore follow that they can also force you to buy broccoli? No, because regardless of your ability to pay, people are forced to give you health care. Nobody is forced to give you broccoli.